I've started doing in some of my workshops is talking about, you know, you've got all these different exercises. Do you know why you do them? Right? Like, do you know why you would introduce it at a particular time? And what the intention of the exercise is? Like, what is it supposed to create? And sometimes you can get people with more sophisticated answers, but other times you get folks who are, they're not quite sure, and they'll just name one of the processes, but they actually don't have the full story of why they're doing a particular intervention. And so then it looks like they're just dropping something in, right? And they'll have a favorite thing that they do, like, you know, whenever you're fused, you put a piece of paper up to your face, or you hold it down, or you put it up or you hold it down. You know, and they'll catch that that's a diffusion exercise. They'll say, I'm doing it to diffuse. But do you know when to do it? Right? Like, maybe it's not called for in every situation. And if a client says a particular thing, you, like, the function of that needs to be known before you would implement a diffusion exercise. And I think that that's missed, and it's a little bit harder thing to train or develop as you go through the process of becoming an ACT therapist or a fluid implementer of ACT.
Well, and the thing that comes up to me as you say that is, I think I tried to imagine what some of my trainees would say if I asked them that. And I think they would say, well, that seemed like some fusion. You know, and that's not quite what we mean. I mean, if somebody, that's not exactly what we mean by what did you just see that caused this to be the right time for this exercise, you know, per se. That it's not like moment of fusion, apply this technique, or here are all your 10 diffusion techniques, just pick one and plug it in. You know, I remember early on feeling like the processes, and indeed just flexibility, inflexibility, like I could see it before I knew what to do about it, you know, and then the moment would be gone, and it would kind of be like, oh, missed opportunity. And so I wonder if that's not the point, you know, in training, where people are trying to go, okay, think of okay, fusion, I see it, fusion, this is definitely some fusion stuff happening here. You know, I would add to that for to do a real sensitive sort of next move, it would be not just, would most people who understand what fusion is watch that bit of behavior and go, yeah, that person's pretty fused. But also, why is that fusion occurring right now? What were the conditions under which they started exhibiting this fused behavior? You know, what happened right before? And then what typically happens when they say stuff like this in their world? You know, how is that fusion being maintained, you know, in their world, that it came up so readily here, and why did it come up? That even though we talk about the aspects of psychological flexibility, those 6 components or 6 processes, even though we talk about them as functional dimensions of behavior, they don't really answer the question of a functional analysis. They don't take the place of a functional analysis in real time. Would you agree with that?
No, I definitely agree. And I think one thing that isn't presented as often in trainings is the other side of the hexaflex, like avoidance, fusion, selfish content, lack of contact with the present moment, not having clarity in your values, and inaction or impulsive behavior. Like, those hint more to what it is that people want to be looking for. Issue is that sometimes those things are happening simultaneously, and sometimes when it's happening it isn't a problem, and sometimes it is. Right, like that's where that function piece becomes so important. So you could have a client in the room who says something that looks very fused, like I really feel like I'm a silly person, let's say. But then they go on to say, to give you more contextual information about it. And I think what happens is that folks pick up on the I'm a really silly person and think, oh, that's a good, now I can do some diffusion there. And they miss the Like what came after it? And you were saying this earlier, Emily, like maybe that's not the most important thing to tackle. Simply because you heard fusion doesn't mean that you have to do diffusion. And it might be more important material might be what came afterwards. And that fusion itself is not necessarily a negative thing. And we actually, in a way, kind of fall into fusion with not diffusion, into fusion with our values. And so I think there's some ways in which it's communicated that any form of diffusion or avoidance, for that matter, should be targeted and tackled in the therapy session. And when indeed that's not the case. Like there's a sensitivity to when, and you're right, like I'm talking about it as bookending and trying to find ways to talk about it that make sense. And so what came before and what came after? Not just for what was happening with the client, but in your intention of doing a technique or an exercise. What came before and where do you want to take it afterwards? Do you have a sense of a line here that's following across time with the client? And I think that overarching process gets missed. And it becomes very like, what should I do now? What should I do now? What should I do now? And so I guess part of what I want to say in thinking about fluidly implementing ACT, mastering the process, is that it's not only knowing what techniques, it's bringing them in a way that fits for the context. And it might mean half of a metaphor. It might mean doing an exercise that lasts a minute. It might mean a 20-minute exercise. Like there's all different kinds of ways in which this can be applied. And getting there, I think, and I'll be interested in your opinion on this, takes time and some supervision and some kind of, really sort of connecting to multiple levels of process, how you feel in the room, what's happening for the client, what's your relationship. And, it's connecting more to process rather than just the content of the exercises.
Yeah, no, I absolutely agree. And I mean, I think when we're saying functional analysis, it would almost translate exactly to what people mean by content versus process. And so process sort of sensitive interventions or process sensitive responses from the client as opposed to content sensitive. Recently, in a consultee, somebody that is a practicing, licensed practitioner that I do some consulting with, that when is the part, he goes, it's almost like you could just do process sensitive, interventions the whole time. Like everything you say would just be processed. He's like, what's the part where you like pause and make sense? And we were talking about it, sense making, the content piece. And my response was, people are gonna sense make. You don't need to provide the context for that. They're gonna sense make. And most likely, if you have a good relationship, they're gonna check in with you on their sense making. So I don't know that you can overemphasize process. I really don't,